Good morning, all. Happy to see you again on a different session. So today's topic is not a new topic. It is actually continuation of the previous topic what we discussed on Thursday. So what did we discuss on Thursday? Notes taking, very good. Can any one of you tell me why should we take notes? What is the use of taking notes? Okay, to memorize. Any other? Yes? Yes, very good. Helps us to review, revise. Anything else? It helps us to understand the concept. What about memory? Does it help us in remembering things? Yes? Yes, it absolutely. So, number one, it will help you understand. You cannot take notes if you really don't understand the content. It helps you to revise a larger content before the exam. It helps you comprehend, and definitely it helps you with better memory, because as I told you, the memory works in different ways. Instead of just going through the content, when you write, when you use your hand, when you use the pen, when you use the tip of the fingers, when you actually write the alphabet, you stimulate more complex network in the brain. Okay. What is the most? I told you 5 names, 5 types. What is the most popular method or most common method used? Yes. What is the name of the method? Okay, tell me what are the different types of notes taking method.
The most popular one is Cornell method.
Cornell, Cornell. All other methods are, developed from this Cornell method. Any other method? Number one is Cornell, then you can refer to your PDF and tell me, no problem. Yeah. Yes, yeah. Yeah, you can give your own method, but what I'm asking now is what is given in the PDF. Yes. Okay, index card method. Any other method? Yes. Yes, 2 column method. So when there is a 2 column, definitely there can be a 3 column or 4 column, but we restrict ourselves to 3 column. The last one, yes. Okay. Yes, outline method. Okay, now I'll give you an example. You tell me which method is useful for this. Name of the drug, mechanism of the drug. What is the method I can use? Name, mechanism. 2 column. Name, mechanism, side effect. 3 column. Name, mechanism, and summarize. Cornell method. When I use the summary is unique to Cornell method. This particular scientist believe that whenever you write a notes, it should be summarized. I just take a postcard, write the name of the textbook, page number, the paragraph number, and write what I read from that particular textbook in a postcard or a small card. What is this method? Index card method. Okay. Yes, you said you want to tell your own method. What is that? Outline method. Okay. As he mentioned, all of us have our own methods. Not necessarily you should follow what is discussed, but these are all time tested. These are all, proved beyond doubts, which has worked globally for many students across universities across decades. If you go to Google and type, uh, you know, scientific article or scientific publication or notes taking, you will see many. Especially now there are more evidence from this part of the world, developing country. Initially we had only US and UK literature, but now we have literature from all over the world. So this is the fifth method, outline method. Have you heard of this word before? Outline. When did we come across the word outline? Writing and presentation, we just mentioned. What is outline? It's very simple. Big topic, subtopic, sub-subtopic, example. That's it. You break down a complex topic into different categories and you write the names under different categories, and you just make a rough concept or rough draft of the main idea is the outline method. Let us see, I will show you some examples. First one, you write the main, not necessarily Roman number or alphabet or numerical. You can just even use a bullet or write just like that. Begin your notes with the main topic, like this, name of the topic. Write the subtopic below, slightly towards the right, like this. List any details below the subtopic, even more slightly indented to the right, like this. This is as simple as outline method. I'll give you another example. So this is how you read a topic and take notes on outline method. Let us take the uses. It's highly structured, very easy to do, levels of information clear, shows the skeleton of the printed information, and it can be used as a supplement for notes taking. Even along with Cornell method, you can use outline method. Before starting with Cornell method, you can do an outline method and then proceed with the Cornell method. It can be a supplement to many other methods. Let us take an example from our medical field. Next year you will be studying about limbs. Limbs means the maybe upper limb or lower limb. It could be anything. So let us assume you read about limb. This is the main topic. So what can be your subtopic? Yeah, upper limb or lower limb. Let us assume upper limb. In this chapter, what could be you studying about? Upper limb structure, yeah. Let us assume this is anatomy, okay? Movement, then muscles, joints, okay? So probably next level is joint. In joint, maybe you read about shoulder joint. So this is the outline method. So when you look at your notes, you will know, okay, in upper limb, I read about a joint. In that joint, I read about the shoulder joint, wrist joint, etc. And I also study about muscle. Under muscle, you can give some examples. Same thing, it can continue for lower limb. Do you see the hierarchy? This is called outline method. A bigger concept, small, smaller, smallest. You go in detail as you go down. This is another example. When you go to year 5 or year 6, you will see lots of patients, you will see lots of symptoms. So in that case, 2 column or 3 column may not be very suitable. Usually in case history, we use outline method. Okay, this is the problem, this is there is pain, and then you explain the pain. This is the vomiting, bullet point for the vomiting. This is the treatment I give, bullet points for the treatment. This is one example. What is distension? Swelling of the abdomen. You see a patient or you read about this in a particular textbook, then you can take notes like this. Under causes, you just put different types of causes. Okay. How? What did I tell you in two-column method? After you write the notes, you keep writing for 3 weeks, 4 weeks. Now you have exam and you want to revise. How do you revise from a two-column method? You any
You read the first column and you cover
Yes, when you use two-column method, you cover the right side of the column. You just look at the left column and try to recollect what is there in the right column. For example, cardiac output. You write the word cardiac output in the left column, definition, and you write the definition in the right column, cover it, and try to tell if you are able to tell the proper definition. And then open it and see if your answer matches what is written on the paper. Similarly, normal value of cardiac output on the left side. You cover the right side, try to recollect, and then if you tell the after you tell the answer, open the right side and see if you have told the correct answer. So you always cover the answers or the right side when you revise from the two-column method. Same thing for three-column. Cover last two columns, try to recollect one by one. How will you revise from outline method? Is it right and left, or how do you revise an outline method? This is the content. Now I have exam tomorrow or next week. How do I revise from this? Which one? How do I cover? How do I use this? Yes. Yeah, correct. How do I use it? Which one should I cover? Is it right, left? Should I cover right half? Cover the bottom. Okay. I should cover, maybe entire till upper limb. Just look at the limbs. Okay, in limbs, what did I read? Okay, upper limb. In upper limb, then you go slowly, slowly, one step down, down, down. This is how we revise outline method. Any doubts till now? Okay. Read one line at a time. Reciting means telling yourself. Explain and recite. Check the accuracy. If needed, add more keywords to the notes which you have already done, and repeat the process. Now, can you take notes during the lecture? Is it possible? Or when you are seeing a YouTube video or when you are listening to a podcast? Can you actually take notes? Yes, it is possible. In fact, it is even more effective. So, can it happen together, listening and writing? Yes, to a great extent, provided how you train your brain. Maybe first time it may be difficult. After 3 months, 4 months, it's just very easy. To know this, first we should know how listening works. How do we listen? What are the steps in listening? Okay. Now, what is your name?
Rima.
Rima?
Rima.
Rimas.
Yeah.
Okay. What did happen just now? What did I do? What did she do? I asked a question, she replied. Okay, let us take the scenario. If I ask the same question in my native language, which she doesn't know, which she has no clue, do you think she would have replied? No. So the first one, the language should be known by both the parties. Okay. Number two, if this hall doesn't have air, it is vacuum. I ask in English, but do you think she would have heard my question? No. Why? The waves has not traveled. Number two. Number three, The room is good, the language is good, but she has some ear infection. She is not able to hear. Do you think she would have answered my question? So the third step is the actual hearing apparatus: external ear, middle ear, and inner ear. Suppose if she is 3 months old, do you think she would have answered this question? No. Why? Language is there, um, it has traveled, her ears are very good. Still, you don't expect an answer from a 3-month old. Why? Interpretation, yes. Understanding and interpretation, it is even more beyond the ear, it happens in the brain. Suppose if I am a stranger, okay, and I don't look good, in the sense I look like a big, um, you know, a criminal, okay, do you think she would have answered my question? No, this is the highest level. Humans decide when to answer, should I answer, and will it lead to any consequence. Okay, this is called secondary interpretation of the brain. So, all these things are important for you to hear and understand. Let us break down this process in a more meaningful way. Listening is an active process. Why it is an active process? When you are in an airport, you hear everything, right? All the sound. Hearing is different from listening. Hearing can happen anywhere. You have to hear because your ears, they receive all signals around you, but not necessarily you should listen. What happens in an airport? There are lots of announcements. You just hear, you don't pay attention. But when the announcement regarding your flight is made, you become attentive, right? How? Because you know it is relevant to you. You become active. So, active listening is very important in a lecture hall. When I speak, I am 100% sure all of you are hearing. I am 100% sure only 30% or 40% of you are listening. So, there is a difference between hearing and listening. So, if you want to take notes, you have to listen carefully, understand what you are hearing, attach meaning to the words, and interpret what the speaker is saying. Let us break it down little more. Here you can see this person is asking something, and also visual stimuli and expression. Why visual stimuli is important? Does it add value to what someone is talking? For example, is making a video call different from making an audio call? Do you just like that do video call to some person who just met? Video calls usually we make to our friends whom we are comfortable, our family members, etc. etc. Audio call is more formal. You just call someone and ask for clarification. What is the difference? Is it different? Yes, definitely. In video, you show your emotion. You add more context, your body language. Especially when you add both of them together, it gives a better meaning and better connectivity. In a lecture also, when you listen to a podcast, it is different. When you attend an actual lecture, when a person is standing in front of you, it is definitely different because you see the body language of the lecturer, the emotions, the stress, etc. So you combine both, and then the next step, you decide if you really want to pay attention to it. Yes, you decide, okay, this information seems to be important, let me pay attention. And then what happens? You try to understand the information. You may understand, you may not understand. Okay, suppose if I have been talking about action potential, the ions going in, coming out, the pathophysiology of basal cell carcinoma. You may understand, may not understand, it depends. So you try to interpret and then assign meaning. What is STM and what is LTM? When you pay attention, simply pay attention, it goes to short term memory. When you understand, try to attach meaning to it, and then it enters to long term memory. And then you decide if you really want to respond or not. This is the sequence of events of anything you hear in your life, not only the academic content, even otherwise. Even if you watch a movie, this is what happens. You hear the content, try to understand, interpret it, and then it goes to, if you like the movie very much, it goes to long term memory. If it is just a simple random movie, it just dies off after a few weeks. Are there different types of listening? Yes. Like learning style, there are also different types of listening. It varies across age group, across culture, and also depends on your emotional maturity. The basic type of listening is active listening. What happens with any student, in school or in college, if he or she is a good student, the first level is active listening. They pay attention and try to understand the new information, first level. And then in college, this is we expect not only active listening, we expect critical listening. What does it mean? You not only understand, you try to interpret, analyze the information given by the speaker. Meaning, you just don't believe me blindly. Whatever I say, you try to, correlate with available literature, you correlate with your own experience, you correlate with your common sense, and that is critical listening. If you are a scientist, do you think all doctors are scientists? In a way, yes. What do scientists try to find answers for? As doctors, we also try to find answers for problems. We all are, in a way, scientists. Try to ask questions, why this is happening, what is the solution, can I do this, do that. And as doctors, we request the third type of listening. What is this? Empathetic. Actually, it's a spelling mistake. It should be empathetic or even empathic. Okay. What is this? When a patient is telling you a complaint, mother is feeling bad that the child is vomiting 10 times. A husband telling you the wife is having pain because of cancer. A daughter talking about the mother, or patient he or himself telling you that they are suffering. Your body language should be different. You will not smile at that time. You will not laugh. You will nod your head, bend down, try to go closer, depending on different cultures wherever you work. But you show an emotion of empathy. You try to acknowledge their emotion. That is empathic listening, where you relate to the person's feelings. And the fourth one is appreciative listening. This is a different type. You really appreciate, or sometimes you would have heard some lectures or some talk by some person, like TED Talk. Once you listen, you feel so happy, you appreciate, yes, I really agree with this person. This is so good. The way they delivered the speech was so good. That is appreciative listening. So there are 4 types of listening. Number 1, active. Next level is critical. As doctor, you should have empathetic listening, and also as a human, you should also have appreciative listening. This is a different concept. This you may not see in the PDF what I uploaded. This I have not uploaded. I will do it today. What is annotation? The answer is there. What is annotation? Whatever you do on the PDF, that is underlining on a printed material. Okay, this is called annotation. You write on a textbook, you write on the soft copy of the PDF, you write on the PowerPoint in your laptop. If already something is printed, on that you do something is called annotation. Do you think it's useful? Many of us, because of the development of the technology, as well as um, learning is a very big topic. Many of us learn in different ways. Annotation is one type of learning. It's very easy, very simple, and very powerful. So you can have different methods. You can do notes taking, you can do annotation, you can listen. Everything has its own value. So how can we annotate? What are you doing on the PDF? Number one, you highlight, then you only highlight. What else you do? Yeah, important keywords you highlight. Apart from highlighting, do you do anything with your? Very good. You write your own interpretation. Maybe some word is difficult, you write your understanding. Maybe you think few points are missing, you put a question mark and write, I should ask this to someone. So you write your own notes. Anything else? Highlighting, then writing your own notes next to the printed notes. Then you add some examples. Okay. In addition to highlighting, some of us feel underlining is useful. Some of us put symbols, star, double star. If something is very important, we put even triple star or put shape. All these things are ways of annotation. I'll show an example. Okay, either you highlight the complete sentence, highlight keyword, circle, enumerate the steps, or make notes. Okay, let us assume this is a paragraph, a medical paragraph. Just take a minute to read the paragraph. I don't want you to make double column or triple column notes. I just want you to annotate. How will you annotate this paragraph? Which one you will highlight? Do you think you will, what will you do? Okay, as he mentioned, the first two lines are the definition. So if you think the whole sentence is important, nothing wrong. Highlight the whole sentence. Okay. You want to highlight all other words, or what will you do? Okay. Yes, you may highlight some keywords. Okay, hypertension are of two types, primary, secondary, and these are the problems. Or even putting shape. This is, you don't have a highlighter, you have only pencil with you. You just can underline or you circle it, the important words. Or the other method is putting numbers. Oh, these are the three causes. Three causes of hypertension, obesity, smoking, salt diet, and these are the three complications of hypertension. This is very important. Why you have to know at least two or three? In future, you will have different types of assessment. In OSCE, professional skills, when you do patient, we will ask you, can you name two complications of this disease? Can you name two causes for this disease? Can you give two medicines for this disease? So we have to know at least two or three common side effects, common complications. So it's better you list them properly. This is another example. Of course, it's not a medical example, just a random paragraph. So they have highlighted the main sentence and then few keywords. There are 4 types of sphere, so they put number: atmosphere, hydrosphere, lithosphere, and biosphere. And also the student wanted to circle it. So sky is the limit. You can combine different things, use different colors, etc., etc. This is the last concept which I want to talk, and very powerful concept for any professional student. It's called concept mapping or mind mapping. Have you heard of this before? It is not writing notes or annotating on the already printed material. You create a diagram. You create a concept connecting different parts of a problem. For example, they are simply diagrams that place the topic in the center. It can be in the center or at the top, anywhere. But just an example, they are telling it's in the center of a diagram with ideas branching out from the main concept. This is called cognitive map, concept map, mind map, etc. I'll give you an example. Concept map. What do I mean by this? It tells the relationship between different things related to one particular topic. This is very important for you next year also. What is the curriculum for next 3 years? Any idea? How are you going to study medicine in this institution? Problem based learning. What is a problem? It's a clinical case. Okay. How do we give your clinical case? We will not give in one page. We will break the clinical case into small segment. We call it trigger. Trigger 1, trigger 2, trigger 3. Usually every problem will have 6 to 7 triggers. Trigger is nothing but cutting down the problem into small pieces. So first we will start with the first trigger. First trigger usually will have name, age, gender, his main complaint, maybe smoker, family history. Some basic information will be there in trigger 1. Trigger 2, usually the elaboration of the complaints and the clinical examination. Trigger 3, usually lab investigation. Trigger 4 will deal with the management, what doctor did. Trigger 5 usually deals with complications or social support or rehabilitation. And trigger 6, if it is there, it will deal with some related concept. This is how classically a problem is broken. So when you read trigger 1, you write, okay, this is Mr. Ahmed, 50 years, pain, right side of the abdomen. This will be your first notes in the paper. Trigger 2, the examination shows pain in the right hypochondrium. Then you look for the connection. Is there a connection between trigger 2 and trigger 1? In trigger 1, patient says pain right side. Trigger 2, examiner keeps the hand and finds pain over the liver. Is there a connection? Yes. History correlates with clinical examination. You put an arrow mark. Okay. This is how we create concept map. Trigger 3, sound shows a big mass in the liver. Is there a correlation? You put another arrow mark. Yes. Pain told by the patient. Examination showed tenderness. Ultrasound showed mass. So all are connected. Similarly, like what I have shown you here, either you can create a concept map for what you study from a textbook, you can create a concept map for a patient, you can create a concept map for whatever new idea you have. If you look at this carefully, it has arrow mark. Without arrow mark, concept map has very less meaning. At least few arrow marks you have to, where is the beginning and where is the end. And you can also use different shapes. Okay, idea which has a rectangle with curved edges. This is sub idea. You can also do outline method first and then convert the outline method to concept map. That is again a very effective way of doing it. So what will happen? Your main idea will be in the center. First subtopic will be the first circle. Your second subtopics will be rectangle. Your fourth subtopics will be this cloud. So you can complement two different methods together. More than the outline, this will go to your long-term memory. Why? Content, outline method, concept map. But concept map will be, you will not forget very soon. Why? Yes, outline also you're writing. Yes, then yes, our brain, as I told you, we are trained for shapes. We are trained for pictures. We are trained for what we see around us. Our visual memory is more powerful, and the shapes, the colors, the arrow mark, and the way it is presented will help you to create connections in the brain. Let us take a medical example: stress management. How do we manage stress? This is another way of doing it. I will show you few more examples just to make you understand. Concept map need not be a particular order. It can be anything, but it should be logical. Okay, you should be able to show the connection between different things. For example, here, types of coping strategy. Main type cognitive, see the arrow mark. So this shows these are the four types, and in cognitive these are the different types. Either you can put an arrow mark or not here, it's up to you, but these are the subtypes. Let us take one more example: hypothyroidism. You will again study pathology and internal medicine more from next year. This is how you create concept map for pathophysiology. What does it mean? The name of the disease or the disorder, the main features of the disorder, and then you put causes, and then clinical features, and below you do how you diagnose, and below you can also mention how do you manage. So this is another way of doing it, very easy and very powerful. All diseases we follow start with the disorder and then go one below the other. Okay, you might ask, I am not very good in doing a concept map, or maybe you become very interested in concept map, you want to do more. If something can help you, there are standard templates available. Okay, but I personally feel first you start with your own template. Take a A4 sheet, take a pencil, just try it on your own. Once you are comfortable, yes, this is how I want to do it, then look for the template online. You can fill the details and store it for later retrieval. But otherwise, this may be more time consuming. Many students feel doing it on a paper and filing it is more easier. It's up to you. You can use a ready-made template, and there are some online platforms which offer you free templates. But the problem with free template, you cannot edit it in a very fine manner, and probably you can use only once or twice. There is some limitation: 2 concept map per week, 3 per week. You can download some of them, you cannot share some of them. So, but as students, even free is okay. Don't go for paid subscription. Even the free templates are okay. The Google Documents also give many templates for concept map. So please use them. Okay, once you start using it, you will know how effective it is. So what did we learn today? To summarize, we revised some of the notes taking methods, Cornell method, 2 column, 3 column, index card, and we saw in detail about outline method. And then what did we see after outline method? Yeah, concept map, and in between concept map and outline method, one more thing I told you, annotation. Okay, annotation is also very, very useful. Please read the handouts uploaded in Moodle. Your exam, we will cover both this and handouts together. So please read the handouts also. Reading handout will give you more understanding of the content. Never depend on PowerPoint alone. Okay? Why? Because the PowerPoint cannot show you everything. We cannot put everything in 20 slides or 30 slides. So it's better you study from the handout. And about today's topic, this concept map and annotation, I have not yet uploaded it. I'll upload it today. Please stay back for one more minute. I want to talk about the second assignment, which we have opened already. Some of you have some doubts. You can ask now, and before you ask, I will clarify. The first slide should be the title slide with your name. Can I have your attention, please? The first slide should be the title slide, your name, ID, course, etc. Second slide should be objectives. What is objective? Whatever you put in table of content, the same thing, but you will write it like a sentence. Identify, blah, blah, blah. Understand, interpret. So you can look, Google how to write objective, or just, it's not as same as table of content. Objective is you add an adjective before. Summarize. Um, for example, if your topic is on upper limb, your objective will be name the joints, name the muscles, list the muscles, enumerate the functions of the muscles, summarize the important functions of the muscle. So that is called list of objective. You need not put a slide number in list of objective. Just put 5 or 6 objectives in the second slide. And then follow the guidelines which we have already told during the class. The font size, the font, and it should not be big sentence. I have seen some of your assignments today, some students showed me, they have put just like their writing assignment, big sentence. No, PowerPoint should never have bigger sentence. It is 6 words, 6 bullet points. It should talk only about one particular idea in one particular slide. Okay, don't write big sentence. In-text citation, yes, again, you have to put in-text citation. You have to have references. References should be authentic. Textbook, journal, maybe some credible websites. Yes. Any doubts? Should it be 10 or 15 slides? It's up to you. Since it is an assignment, always go towards the higher side of the spectrum. Don't settle with 10 slides. We expect you to settle with 14 or 15 slides. Any more questions on? Yes? It's okay, but don't go 20. 16, 17, okay. Not beyond that. So respect the number 15. Yes. Yes, yes. From title page to thank you page. I mean, so you can have 15 or 17. It's up to you. Any? Some students ask me, can we use the same topic? It's up to you, but we encourage you to use the different topic. Okay. Yes. Uh, Here we don't call it table of content. Here we call it list of objectives. Your second slide, the objectives. Objectives are actually the content of the PowerPoint. Okay. You can see some examples. There are hundreds of examples available online. You see some of them, you will understand. Yes.
The topics are the same as the topics for the first
It
semester.
should be, yes, it should be from basic science, anatomy, physiology, biochemistry. Okay. But do you want to do the same topic what you did for writing assignment? We strongly recommend you choose another topic. If you have written about heart, now you write about stomach. If you have written about cardiac cycle, this time you write about digestion. So even though we are not going to check individually, but you know, it's good to do a different topic. Yes.
It's not going to affect our mark if we did the same subject.
Yeah, we will not reduce mark, but it reflects bad. The student doesn't want to put more effort. So I'm just telling you. Yeah. Thank you very much. Anything else you want to ask? Yeah. Yeah. Don't ask for extension. Finish it off. Submit it. Okay. Thank you. And about marking of wait, how many of your friends have not submitted? Please listen. Assignment 1 we have not received from some of the students. If you can talk to them, you can put in the WhatsApp group or whatever. Ask them to submit, and then only we can grade and release for everybody. We are waiting for some of your friends to submit. Yeah. Thank you. Oh, I didn't do the conclusion. Okay.
Doctor,
Okay, Neha.
you added some files about the note taking.
Yeah.
What do we do with them?
I told you have to study.
Like, other than this file?
Yes, I repeat, please read the handouts. For exam, don't depend only on the PowerPoint, read the handouts. You will have questions from handouts as well. Yes, you
All
have to
of them.
study. All of them. If there is something you see in your course uh, page, it is not for fun. You have to study. Yes.
About the
Thank you.
slides in the presentation,
Yeah.
should I write the reference in every slide or?
Please listen, whoever 6 students here.